Hello, hello, class, and happy Thursday. I'm Rabbi Black, and welcome to Genetics 101. Today we will be talking about Klinefelter syndrome. What is Klinefelter syndrome? Klinefelter syndrome is a genetic condition that affects only males. This chromosomal disorder results when a boy is born with an extra copy of the X chromosome. The genetic makeup for a boy with Klinefelters is XXY, meaning it has a chromosome pattern of 47 instead of the normal karyotype 46. Do any of you students know the history of Klinefelter syndrome?
Rabbi Black, I know the answer to that. Well, Klinefelter syndrome was first identified in 1942 by Dr. Harry Klinefelter, who was a doctor in the Massachusetts Boston Hospital. The symptoms were discovered as there were 9 men with ladylike features and could not produce sperm. By the 1950s, researchers recognized Klinefelter syndrome, where the male had an extra sex chromosome causing their sex genetic makeup to be XXY.
Great job! What are the causes of this disorder?
The cause of this disorder is as a result of non-disjunction in either meiosis 1 or 2 when producing gametes. In meiosis 1, the homologous pairs do not separate, resulting in 2 trisomy gametes and 2 monosomy gametes. If non-disjunction was to occur in meiosis 2, it would result in 1 trisomy, 1 monosomy, and 2 normal gametes. Both mother and father can be responsible for causing this disorder. With the mother, she can give 2 X's as a form of non-disjunction in meiosis 1 or 2. The father can give both an X and Y, also because of non-disjunction, therefore the child will have the sex genetic makeup of XXY. Klinefelter's is a full chromosomal disorder, and it only relates to sex chromosomes. It is not inherited, it is purely caused by non-disjunction, therefore it is neither dominant nor recessive.
What are the methods of diagnosing Klinefelter syndrome?
The methods are by physical signs and tests. However, it is very rare to diagnose males with Klinefelter syndrome before puberty, as the signs only appear during puberty. Another way is hormone tests, which are urine and blood samples, which will show irregular hormone levels that correspond to Klinefelter syndrome, which will show more estrogen than testosterone.
Karyotypes are another way to diagnose Klinefelter syndrome, as a doctor could see the trisomy in the sex chromosomes.
Can anyone try and guess how often it occurs?
1 in 500 to 1,000 males are affected with Klinefelter syndrome. Only 25% of males are detected with Klinefelter syndrome, and the other 75% do not know if they have it or not, as they do not show any signs or symptoms. The only way to diagnose is by the methods. However, one would only get the methods done if it is suspected.
Did you know that the signs and symptoms are different in males depending on their stages of development?
Some signs and symptoms are weak muscles, developmental delays, quiet submissive personalities, and complications at birth.
A taller than average stature, absent, delayed, or incomplete puberty, smaller testes, which is testicular atrophy, osteoporosis, infertility, enlarged breast tissue, which is called gynecomastia, reduced facial and body hair, amongst many others.
Mr. Black?
Hey, that's Rabbi to you, bucko.
Are there any treatments to this disorder?
Great question. Although there is no cure for Klinefelter syndrome or any ways to prevent it, there are methods to treat the individual's symptoms. This treatment is to supplement their lack of testosterone. Boys with Klinefelter syndrome are given an injection or a gel patch to the skin. As a treatment for enlarged breasts, excess breast tissue can be removed by a plastic surgeon, leaving a normal-looking chest. Speech and physical therapy can help boys with Klinefelter syndrome overcome problems with speech, language, and muscle weakness.
Now, class, last question of this course. Is there any further research being done?
Researchers at Columbia University Medical Center have created a tool to aid pediatricians to diagnose boys with Klinefelter syndrome. Using this tool will prevent the impairments brought with Klinefelter syndrome to form. This tool is called the Klinefelter Physical Phenotype Index.
Thank you for attending Genetics 101. I hope you learned a lot today about Klinefelter syndrome.
Created using Powtoon.